The growth of digital innovation has been rapidly redefining and reshaping the right to health, and it has strengthened the ability of some governments to respect, protect, and fulfill this human right by ensuring that all health services, facilities, and goods are available, accessible, acceptable, and of quality. Digital transformation tools, if they are developed, used, and regulated without consideration of their human rights impact, can enable violations and may undermine economic, social, cultural, civil, and political rights, including the right to health. And this report brings into light some insights and recommendations on these matters. Telemedicine, telehealth, and other digital forms of healthcare solutions offer great potential for scaling up in terms of physical accessibility and can improve the accessibility to mobile diagnostics, healthcare workers for screening and advice, and the delivery of therapeutics, for example. And now the adoption of technologies should not lead to divestment in underlying determinants of health or medical facilities and services, particularly those serving the people in vulnerable situations, such as those in rural areas, migrant populations, LGBTIAQ+, and other gender diverse persons, indigenous people, and older persons, amongst others. Digital tools perpetuate racism, sexism, ableism, or discrimination based on sexual orientation or gender identity, amongst others, both in coding, design, as well as in application. And I support the call for design justice, in which technology is designed through diverse and inclusive processes to meet diverse and local needs. The right to health includes a right to access sexual and reproductive health-related education and information. And in this regard, in March 2023, together with 3 other mandates, we issued a compendium on comprehensive sexuality education that is available online. In certain circumstances, you have companies and private sector bodies that can be compelled by law enforcement bodies or courts to hand over personal data for criminal investigation purposes. This intensifies concerns as to how genomic data and medical data can be used to capitalistic gains and profiteering as well. Both state and non-state actors in the context of criminalized health services such as contraception and abortion, where people who seek abortion and individuals who help them risk arrest or prosecution. The mobile communication and geomapping and their search history data can be used as evidence against them in court and being accused of having, providing, or assisting in an abortion. This is not good practice, and it is contrary to the right to health framework. In addition, human contact remains important for primary care, and concerns remain valid that digital delivery of mental health services, for example, may be inferior as a form of healthcare in comparison to in-person treatment. A human rights-based approach must also therefore ensure meaningful participation of civil society and communities in subnational, national, and global governance of digital health. There must be investment in improving literacy regarding the entire digital pipeline, and that public education must be undertaken to ensure rights holders are informed about their rights, but specifically their digital health rights. It is important to adopt a policy approach to the right to health as it allows for transparency, accountability, and recourse. Digital innovation and technologies are an asset to the operationalization of the right to health, and they present multifaceted experiences, not all good and also not all bad. An intersectional rights-based approach to digital innovation and technologies must be adopted to move towards substantive equality and to create conditions conducive to a life of dignity, both in real life but also in online spaces. And states have human rights obligations to respect, fulfill, and protect the right to health. And again, there must not be a divestment in primary healthcare systems, in specialized healthcare, as well as services and goods, with a focus only on digital health tools.